She was 74, her name was Margaret, and when she walked into my office, she moved slowly, one hand gripping the wall for balance. For months, she thought her tired legs and aching hips were just old age. She laughed it off when her daughter told her she seemed weaker and more forgetful. But that morning, Margaret nearly collapsed in her kitchen, spilling hot coffee across the floor. Her bones had thinned, her muscles had weakened, and her mood had sunk into a deep sadness. The shocking part? It wasn't a rare disease, it wasn't something hidden. It was a common deficiency, something almost every senior over 60 faces but rarely notices until the damage is already there. That's what made it so dangerous. And as her doctor, I had to tell her the truth. It was vitamin D deficiency slowly breaking her down. If you are over 60, this story could be you or someone you love. That's why before we begin, I need you to do one thing. Subscribe to this channel right now and comment below with your age. Why? Because stories like Margaret's are far too common, and by sharing your age, you not only remind yourself to stay accountable, but you help me create senior-focused videos that may literally save lives. Don't wait until you collapse. Subscribe and comment before you forget. Now, let's get into the 5 warning signs of vitamin D deficiency after 60, each one a red flag I've seen again and again in my patients. The first warning sign is muscle weakness. I don't mean just getting a little tired after climbing stairs. I mean that slow, creeping weakness where standing from a chair feels harder than it did last year, or holding a grocery bag feels heavier. Vitamin D is essential for muscle strength, and when levels drop, seniors lose stability. This is why so many older adults start experiencing small stumbles that turn into major falls. The danger is that one fall can break a hip, and one hip fracture can take away independence permanently. The benefit of catching this early is enormous. If you notice weakness, simple blood testing and correcting vitamin D levels can restore strength and protect independence. And here's the shocking part. Most seniors never realize it's not just aging. It's preventable. Stay with me because the next sign is even more dangerous. The second warning sign is bone pain and frequent fractures. Many seniors think brittle bones are only about calcium. But without vitamin D, calcium cannot be absorbed properly, and the bones begin to thin quietly year after year. I've seen patients who broke a wrist just by leaning on the counter. Imagine reaching to open a cupboard and ending up in the emergency room with a broken arm. The benefit of knowing this is that bone pain, especially deep, dull aching in your back, hips, or ribs, should never be dismissed as arthritis without testing vitamin D. When we catch deficiency early, we can protect bone density, prevent fractures, and reduce the risk of being confined to a nursing facility after an accident. This is why I tell every patient over 60, pay attention to your bones because they are the foundation of your independence. And if you think that's frightening, wait until you hear the third sign because it doesn't just affect the body, it strikes the mind. The third warning sign is low mood, even depression. Many seniors tell me they feel a gray cloud over their life, but they assume it's just aging or loneliness. The truth is, vitamin D plays a critical role in brain chemistry. Low levels disrupt neurotransmitters that control mood, leading to sadness, anxiety, and even cognitive decline. I had a patient, James, age 68, who thought he was developing dementia because he kept forgetting names and felt constantly drained. But once we corrected his severe vitamin D deficiency, his mood lifted, his memory sharpened, and he told me, "I feel like I got 10 years of my life back." The shocking part is how quickly this improvement can come once deficiency is addressed. For seniors watching this, if your mood feels heavier, don't dismiss it. A simple test could uncover a reversible cause. And if you think memory loss and mood changes are scary, the next sign could be even more life-threatening. The fourth warning sign is frequent infections. If you notice you're catching colds more often, fighting off lingering bronchitis, or healing slowly from minor wounds, it could be your immune system calling for help. Vitamin D is not just about bones, it is one of the body's strongest immune regulators. Seniors with low levels are far more likely to develop pneumonia, urinary tract infections, and even shingles. I've seen seniors hospitalized for weeks because their immune systems failed to fight off what should have been a mild infection. The benefit here is that correcting vitamin D levels strengthens your defenses, reducing hospital visits, cutting down medication use, and giving you resilience to keep living independently. Imagine avoiding not only the fear of hospitalization, but also the long, slow recovery that follows. And the fifth warning sign, which I'm about to share, might be the most visible of all, yet most ignored. The fifth warning sign is delayed wound healing and skin problems. When cuts, bruises, or even small scrapes take unusually long to heal, it's a silent alarm bell. Vitamin D deficiency slows down the repair processes that keep skin strong and resistant to infection. I had a 71-year-old patient named Carol who noticed that a tiny scratch from gardening stayed open for weeks. She thought it was just thin skin until we discovered her vitamin D was critically low. Once corrected, her healing improved dramatically and her risk of infection plummeted. The clear message for seniors: pay attention to your skin, because it often shows what your bones and immune system are suffering silently. And here's where I need to pause and ask you again. If you're finding this helpful, subscribe right now. This is the single most important way to make sure you never miss life-saving information like this, and it helps us reach more seniors who may not know they are at risk. Now that you know the 5 warning signs, muscle weakness, bone pain, low mood, frequent infections, and delayed healing, what can you do about it? The solution has 2 parts, and I will keep it simple because overwhelming information often leads to no action at all. The first step is testing. Ask your doctor for a 25-hydroxy vitamin D blood test. It's simple, inexpensive, and it gives a clear picture of your levels. Don't guess. Too little is dangerous, but too much supplementation can also be harmful, especially if you have kidney or liver issues. The second step is safe correction. This usually involves moderate supplementation guided by your doctor, often in the range of 800 to 2,000 international units per day, sometimes more if deficiency is severe. Combine this with regular safe sunlight, just 10 to 15 minutes on arms and face a few times a week if your doctor approves. And for food, focus on fatty fish like salmon, fortified dairy, or egg yolks. These are simple, senior-friendly changes that build strength, protect bones, and restore energy. Let me pause here and tell you about a patient who made this change and saw his life transform. Robert, age 73, came to me with constant fatigue, dull back pain, and recurring colds. He had been on antibiotics 3 times in 6 months. His daughter worried he wouldn't be able to stay in his home much longer. His blood test showed severe vitamin D deficiency. We began a safe, gradual supplementation plan and added moderate sunlight exposure. Within 3 months, Robert's energy improved, his colds stopped, his back pain eased. Most importantly, he regained his independence. He started gardening again and told me he felt alive. This is the benefit I want every senior to experience, and it's why I'm urging you not to wait. As you listen, you might be wondering, is it really that simple? Could one vitamin play such a powerful role in so many systems of the body? The answer is yes. Vitamin D acts more like a hormone than a vitamin. It regulates bones, muscles, immune function, even mood and brain health. Without it, the entire body starts to weaken. With it, seniors stay stronger, more resilient, and more independent. And here's the curiosity loop. Correcting your vitamin D doesn't just stop weakness and fractures. It may protect your heart, reduce the risk of certain cancers, and even lower inflammation linked to dementia. That's why the benefits extend far beyond what we covered today. So let me repeat clearly. If you're over 60, you cannot afford to ignore these 5 warning signs. Weak muscles, aching bones, low mood, constant infections, and slow healing are not just aging. They are danger signals. If you see yourself in these signs, talk to your doctor about testing. Don't rely on guesswork. Don't put it off until your next annual visit. The longer deficiency lingers, the more damage it does quietly. As a doctor, I've seen patients transform after correcting vitamin D. They go from fragile and fearful to stronger, more confident and more active. That's why I stress, don't ignore the signs. If you noticed any of the 5 warning signals in yourself, weakness, bone pain, low mood, infections, or slow healing, this is your body telling you something serious. And if you're still here, that shows you care about your health and your future. So I'll end with this. Subscribe to this channel and leave a comment below sharing which sign you've noticed most in your life. Ignoring this could mean a future of fractures, infections, and lost independence. Acting now could mean years of strength, freedom, and joy. The choice is yours, but don't wait. Subscribe, comment, and take control of your health today.